Garlic has been called nature's medicine for thousands of years. And today, nearly 70% of older adults in the United States use garlic regularly, trusting it to lower blood pressure, strengthen the immune system, reduce inflammation, and even protect the heart and brain with age. Many of you may sprinkle garlic on pasta, stir it into soups, or even swallow a raw clove before bed, believing you're doing something good for your body. But here's the surprising truth. Even something as healthy as garlic can quietly turn harmful if it's eaten the wrong way. Over the years, I've seen seniors come to me with stomach pain, dizziness, or sudden spikes and drops in blood pressure, only to discover that garlic itself wasn't the problem, but rather how it was being used. For older adults, whose digestion is more sensitive and whose hearts, kidneys, and livers require extra care, these mistakes can be far more dangerous. Too much raw garlic can irritate the stomach lining. Mixing garlic with the wrong medications can thin the blood excessively. Storing garlic improperly can allow dangerous toxins to form. And even combining garlic with the wrong foods can block nutrient absorption instead of helping the body heal. I'm Dr. Emily Carter, and for more than 20 years, I've helped seniors use food as medicine to stay strong and independent. And today, I want to shine a light on the hidden side of garlic, the side that most people never talk about. Because the truth is, garlic can either be your most powerful ally or a silent enemy, depending on how you use it. In this video, we'll uncover the 10 dangerous mistakes seniors make with garlic. By the end, you'll know exactly how to enjoy garlic's amazing benefits, while avoiding the hidden risks that could quietly harm your health. So before you take your next bite of garlic, let's begin with the very first mistake you need to avoid. Mistake number 1, overcooking garlic, losing its healing power. Garlic is often praised as a natural medicine, but one of the biggest mistakes seniors make is overcooking it. Imagine this. You've just prepared a hearty pot of soup or stew, and you toss in your chopped garlic at the very beginning, letting it boil for 20 or 30 minutes. By the time you take your first spoonful, most of garlic's healing compounds are already gone. The key compound in garlic is allicin. This sulfur-containing molecule is what gives garlic its sharp smell and its powerful benefits, lowering blood pressure, fighting infections, protecting the heart, and even strengthening the immune system. But here's the problem. Allicin is extremely unstable. Research shows that allicin begins to break down within minutes of being exposed to high heat. By the time garlic has been fried, baked, or boiled for too long, allicin is completely destroyed, leaving behind only the flavor, but not the health benefits. I remember one of my patients, Mr. Johnson, a 72-year-old retired teacher. He told me proudly that he cooked garlic every day in his sauces, soups, and stir-fries. Yet when we looked closer, he always sautéed it on high heat for 10 minutes or more until it turned brown and crispy. He loved the taste, but he wasn't actually getting any of the cardiovascular protection that garlic is famous for. In fact, studies from the Journal of Nutrition confirm that prolonged heating, especially above 140 degrees Fahrenheit, 60 degrees Celsius, destroys the very compounds that make garlic nature's medicine. This matters more for seniors because garlic's protective effect against high blood pressure, cholesterol, and infections can truly make a difference after age 60. If you're cooking garlic until it's dark and bitter, you're losing the very reason you added it in the first place. So what's the right way? The good news is you don't need to give up your favorite recipes. Instead, try this simple trick. Add garlic toward the end of cooking, not the beginning. For example, when making soup, toss in crushed garlic only in the last 5 minutes. If you're sautéing vegetables, add it once the heat is lower, just before serving. This way, you still get the aroma and flavor, but you also preserve much of the allicin and other sulfur compounds. Another option is to eat garlic raw or lightly cooked. For seniors with sensitive digestion, you don't need a whole clove. Just a small piece crushed into a salad dressing or stirred into warm, not boiling tea can provide benefits without overwhelming your stomach. The takeaway is simple. Overcooking garlic makes it nearly useless as a medicine. Seniors need to be extra careful because every bit of natural support for the heart, brain, and immune system counts as we age. By treating garlic gently, never burning it, never boiling it for too long, you can keep its healing power alive in every meal. Mistake number 2. Chopping garlic and cooking it immediately, missing the allicin boost. One of the most fascinating things about garlic is that it isn't born with its healing power fully active. Garlic contains 2 important compounds: allicin, a sulfur-based molecule stored inside the garlic clove, and alliinase, an enzyme that lives in separate compartments. When you crush, chop, or mince garlic, these 2 finally meet and react, creating allicin, the compound responsible for garlic's strong smell and its most powerful health benefits. But here's the mistake many seniors make: chopping garlic and immediately tossing it into a hot pan or boiling pot. The moment garlic hits the heat, the delicate enzyme alliinase is destroyed, and allicin doesn't have enough time to form. The result? You get flavor, but you lose nearly all the antibacterial, anti-inflammatory, and heart protective benefits that garlic is known for. Let me share the story of Mrs. Thompson, a 68-year-old grandmother who came to see me about her recurring colds. She told me proudly, "I use garlic every day, doctor. I chop it and cook it right into my eggs every morning." But when I asked how she prepared it, she admitted that she cracked the eggs, threw them straight into a hot pan, chopped garlic quickly, and added it immediately while the oil was already sizzling. By the time she finished, alliinase had no chance to work, so her garlic wasn't giving her immune system the support she thought it was. Scientific research backs this up. A study from the Journal of Agricultural and Food Chemistry found that letting crushed garlic rest for at least 10 minutes before cooking allows maximum allicin formation. If you skip this step, the enzyme never activates, and allicin levels drop dramatically. In fact, garlic that's allowed to rest even for a short while retains significantly more antibacterial and cardiovascular benefits compared to garlic cooked immediately. This is especially important for seniors because after age 60, the immune system weakens naturally, and the risk of infections, high blood pressure, and poor circulation rises. Garlic can help protect against these issues, but only if it's prepared the right way. So what's the solution? The fix is simple and doesn't require you to change your diet drastically. Whenever you chop, mince, or crush garlic, let it sit on the counter for 10 to 15 minutes before cooking. This pause allows the magic reaction to happen, turning allicin into allicin. After that, you can cook it. And although heat will eventually reduce allicin levels, much of its protective power will already be locked in. Here's a practical tip. If you're preparing dinner, chop your garlic first before you start anything else. By the time you've finished washing vegetables or setting up your pan, your garlic will have had enough time to activate. Then, when you add it to your food, you'll get both the delicious flavor and the full range of health benefits. The takeaway? Garlic is like a tiny chemistry lab in your kitchen. If you rush it straight into the pan, you miss the best part. But if you're patient, just 10 minutes patient, you unlock its full. Mistake number 3. Cooking garlic at too high a temperature, destroying its healing compounds. Garlic is a delicate food. Unlike some vegetables that can withstand intense boiling or frying, garlic's most valuable compounds are fragile. One of the most common mistakes I see seniors make is cooking garlic at very high temperatures, especially frying it until it turns dark brown or black. While it may add a smoky flavor, the health benefits are almost completely destroyed. Why does this happen? Garlic's power comes from its organosulfur compounds, especially allicin, and its breakdown products like diallyl sulfide and S-allylcysteine. These compounds are heat sensitive. Research shows that when garlic is exposed to temperatures above 350 degrees Fahrenheit, 177 degrees Celsius, which is typical for frying in oil, its beneficial sulfur compounds degrade rapidly. Instead of lowering blood pressure and fighting inflammation, burned garlic can produce acrylamide and other harmful byproducts that may irritate the stomach and even increase oxidative stress in the body. I recall a patient, Mr. Harris, a 70-year-old who loved cooking big breakfasts. He told me he always fried garlic directly in hot oil to release the flavor. Unfortunately, he often cooked it on high heat until it was nearly black. He believed he was strengthening his heart, but instead, the compounds that protect against high cholesterol and infections were long gone before his meal even hit the plate. What was left was bitterness in taste and no health benefit for his circulation or immune system. This issue is particularly important for seniors because after 60, the body's natural defenses weaken. High blood pressure, stiff arteries, and reduced immune function are already common. Garlic can be a natural ally, but only if it's handled gently. Cooking it at high heat wipes out exactly what seniors need most. So how can you fix this mistake? The solution is simple. Lower the heat and control the timing. If you're sautéing, use medium or low heat and add garlic after your oil has cooled slightly, not when it's smoking hot. Garlic should be cooked until it's lightly golden, never brown or burnt. A gentle sauté of 30 to 60 seconds is enough to release the aroma and preserve many of its beneficial compounds. Another trick is to combine garlic with other foods that can protect its compounds. For example, studies suggest that cooking garlic with onions or tomatoes at lower heat helps preserve more antioxidants. You can also add garlic at the end of cooking, such as stirring it into a sauce after removing the pot from the heat so that it warms without being scorched. For those who find raw garlic too strong, roasting it at low temperatures, below 250 degrees Fahrenheit, 120 degrees Celsius, can sweeten the flavor while keeping many compounds intact. It won't have the same potency as fresh raw garlic, but it's far better than burning it in a hot pan. The bottom line? High heat kills garlic's medicine and replaces it with toxins. Seniors should think of garlic not as just a spice, but as a healing food that requires gentle care. Treat it kindly. Avoid frying it in smoking hot oil, and you'll preserve the heart, brain, and immune benefits that nature intended. Mistake number 4. Eating garlic right after brushing your teeth. Hidden damage to gums, teeth, and stomach. Most of us think brushing our teeth is the healthiest way to start or end the day. And it's true. Oral hygiene is essential, especially for seniors who are more prone to gum disease and tooth sensitivity. But here's a surprising mistake: eating raw garlic immediately after brushing your teeth. Why is this a problem? After you brush, your gums and enamel are in a sensitive state. Brushing removes plaque and bacteria, but it also temporarily weakens the protective enamel layer and slightly irritates the gums. At that very moment, if you eat raw garlic, the strong sulfur compounds and natural acids can directly irritate exposed gum tissue, causing a burning sensation, redness, or even micro damage that accumulates over time. I once met Mrs. Reynolds, a 74-year-old who believed in taking a clove of raw garlic every morning for her heart. But she had developed constant gum soreness and occasional bleeding when she flossed. After a dental check, the dentist confirmed her enamel was thinning and her gums were inflamed. The cause? She always chewed her garlic right after brushing her teeth, when her mouth's protective layer was at its weakest. There's also another risk: the stomach. Brushing stimulates saliva and slightly alters the pH balance in the mouth. If raw garlic is eaten right after, it travels quickly to the stomach with fewer protective buffers. For seniors who already have thinner stomach linings or conditions like gastritis and acid reflux, this can lead to pain, burning, and nausea. In some cases, it can even worsen gastric ulcers. From a scientific perspective, garlic contains sulfur compounds such as allicin and diallyl disulfide, which have strong antimicrobial properties. While these are beneficial in moderation, they are also caustic, meaning they can irritate soft tissues. Normally, eating garlic along with food, or at least some buffer, helps reduce this irritation. But eaten directly on freshly brushed gums, it's like pouring lemon juice on a small cut. It stings and weakens tissue healing. So, what's the right approach? Seniors don't need to give up garlic. Just time it properly. Here are some safe strategies. Wait at least 30 to 60 minutes after brushing before eating raw garlic. This allows saliva to restore the protective film on your teeth and gums. Combine garlic with food, eating it with a slice of bread, mixing it into yogurt, or blending it into a salad. Dressing makes it gentler on the mouth and stomach. Choose lightly cooked garlic instead of raw if your gums are sensitive. Cooking mellows its harsh compounds while preserving many benefits. Rinse your mouth with water after eating garlic to wash away acids and sulfur compounds that linger on teeth. For seniors, protecting oral health is just as important as protecting the heart. Gum infections and tooth loss are linked to higher risks of heart disease and even dementia. Garlic can be your ally, but only if you use it wisely. The takeaway is simple. Never chew raw garlic immediately after brushing your teeth. Give your gums and enamel time to recover, and enjoy garlic with food instead of on its own. This way, you get the full benefits for your heart and immune system without sacrificing your smile or your stomach's comfort. Mistake number 5, leaving crushed garlic out for more than 2 hours. From medicine to toxin, garlic is one of the few foods that becomes more powerful once it's crushed. When you smash or mince a clove, the enzyme alliinase meets the compound allicin, creating allicin, the very molecule that gives garlic its healing power. This is why garlic is often called a natural antibiotic, and why it's linked to lower blood pressure, stronger immunity, and better circulation. But here's where many seniors make a dangerous mistake: leaving crushed garlic exposed to the air for too long. Why is this harmful? Once garlic is broken apart, its delicate sulfur compounds are unstable. They begin to oxidize when exposed to oxygen, light, and room temperature. After about 2 hours, allicin and related compounds not only lose their potency, they can also start producing oxidation byproducts that irritate the stomach and liver. Worse, if garlic is left out in oil or moist environments, it becomes a breeding ground for Clostridium botulinum, the bacteria responsible for botulism, a rare but deadly foodborne illness. I remember speaking with Mr. Lewis, a 69-year-old who loved preparing meals in advance. He often crushed a big batch of garlic in the morning and left it on the counter to save time for cooking later in the day. Unfortunately, he began noticing frequent stomach upset and bloating. When we reviewed his cooking habits, the culprit was clear. His garlic was sitting out too long, oxidizing and turning from medicine into an irritant. Scientific studies confirm this. Research from the Institute of Food Science and Technology shows that garlic's active compounds degrade rapidly after being cut, especially when stored at room temperature. After 2 to 3 hours, most of its beneficial allicin is gone. If garlic is stored in oil without refrigeration, dangerous bacteria can multiply in the oxygen-free environment, creating toxins that are invisible and odorless but highly toxic. For seniors with weaker immune systems, even a small exposure can be serious. So what should you do instead? Fortunately, the fix is simple and safe. Use freshly crushed garlic within 10 to 30 minutes. This is the golden window when allicin is at its peak. If you need to prepare in advance, refrigerate immediately. Store crushed garlic in a sealed container in the fridge and use it within 24 hours. Avoid storing garlic and oil at room temperature. If you want garlic oil, make small batches and keep them refrigerated to prevent bacterial growth. Consider whole cloves. Garlic that remains whole is much more stable. Crush or chop only what you plan to use soon. For seniors, this is especially important. As we age, the stomach lining becomes more sensitive and the immune system weaker. Eating oxidized or contaminated garlic can mean not just losing the benefits, but actually harming the gut, liver, and overall health. The takeaway? Garlic is a medicine that comes with an expiration clock once it's crushed. Treat it like a fresh prescription. Use it quickly, don't leave it sitting around, and never store it carelessly in oil. This way, you'll capture all of garlic's healing potential, without the hidden risks that can quietly undo its benefits. Mistake number 6, eating garlic during cancer chemotherapy. A risky interaction with treatment. Garlic has long been seen as a healing food, praised for its ability to fight infections, boost immunity, and protect the heart. For many seniors, it feels like the perfect natural support during difficult times, including cancer treatment. But here's the surprising truth. Eating garlic, especially in large amounts during chemotherapy, can sometimes do more harm than good. Why is this the case? Chemotherapy drugs are carefully designed to target rapidly dividing cancer cells. They are powerful and often come with side effects, but their effectiveness depends on reaching a very precise balance in the bloodstream. Garlic contains sulfur compounds, especially allicin, diallyl disulfide, and S-allylcysteine, which can alter how the liver processes medications. Specifically, garlic can interfere with the cytochrome P450 enzyme system in the liver, the same system responsible for breaking down many chemotherapy drugs. This means garlic may change the speed at which these drugs are metabolized, either making them less effective or increasing their toxicity. For example, some studies suggest garlic can thin the blood and alter clotting, which raises the risk of excessive bleeding during treatment, a dangerous situation for already fragile patients. I recall a patient, Mrs. Alvarez, a 66-year-old woman undergoing chemotherapy for breast cancer. She told me she was taking extra garlic supplements because she heard it would boost her immunity. But soon she began experiencing unusual bruising and nosebleeds. Her oncologist discovered that garlic was amplifying the blood-thinning effects of her medication, putting her at unnecessary risk. Once she stopped the garlic supplements, her bleeding stabilized. The science is clear. While garlic is beneficial in many situations, it can counteract or interfere with certain chemotherapy drugs such as cyclophosphamide, doxorubicin, and others. This doesn't mean all garlic must be avoided, but it does mean seniors on cancer treatment should never self-prescribe garlic as a natural therapy without consulting their doctor. So what can you do if you love garlic but are undergoing chemotherapy? Here are some safe guidelines. Talk to your oncologist first. Always inform your care team about any garlic use, especially supplements or raw garlic in large amounts. Avoid concentrated garlic supplements. These carry the highest risk of drug interaction. Use small amounts of garlic in food if your doctor approves. A little garlic in a cooked meal is generally safer than raw cloves or pills. Focus on other gentle immune-boosting foods. Berries, leafy greens, and probiotics like yogurt or kefir can support immunity without interfering with chemotherapy. For seniors battling cancer, the priority should always be maximizing the effectiveness of treatment while minimizing risks. Garlic may be powerful, but in this situation, power can backfire. The takeaway: garlic and chemotherapy don't always mix. What seems like a natural immune booster can actually weaken your treatment or increase side effects. If you or a loved one is in cancer therapy, the safest step is to ask your doctor before using garlic in any form. That way, you'll protect both your health and the success of your treatment. Mistake number 7, eating too much garlic with Alzheimer's, a hidden risk for the aging brain. For years, garlic has been praised as a brain-friendly food. It's true. Some studies show that moderate garlic consumption may improve blood flow, reduce inflammation, and even help protect memory. That's why many seniors with concerns about dementia or Alzheimer's disease add garlic to their diet daily, believing it will help sharpen the mind. But here's the overlooked side. Too much garlic can sometimes worsen symptoms in seniors already struggling with Alzheimer's or other forms of dementia. Why? Garlic's sulfur compounds, while powerful, can overstimulate certain brain pathways when consumed in excess. Some laboratory studies suggest that high doses of garlic extract may disrupt the balance of neurotransmitters, the chemical messengers that allow brain cells to communicate. For healthy adults, this may not cause a noticeable problem, but for seniors with Alzheimer's, whose brains are already vulnerable, overstimulation can lead to increased confusion, agitation, or even changes in mood. I once spoke with the daughter of Mr. Collins, a 78-year-old man diagnosed with early Alzheimer's. She explained that she had been giving him raw garlic daily, believing it would fight memory loss. but she noticed that on days when he ate more than usual, he became unusually restless, had trouble focusing, and even complained of headaches. When they reduced his garlic intake, his symptoms eased. While garlic wasn't the cause of his Alzheimer's, it was making his brain more unstable. Scientific findings back this up. While moderate garlic may protect against the buildup of amyloid plaques, a hallmark of Alzheimer's, excessive intake can have the opposite effect, increasing oxidative stress in the brain. Some animal studies have shown that very high doses of garlic extracts may actually impair memory and learning. This is especially concerning for seniors with dementia, whose neurons are already fragile. Another hidden issue is weight loss and malnutrition. Garlic in large amounts can reduce appetite or irritate the stomach, leading to less food intake. For Alzheimer's patients who often struggle with maintaining weight, this can accelerate frailty and cognitive decline. So what's the safe approach? Seniors with Alzheimer's don't need to completely avoid garlic, but they should use it carefully and moderately. Stick to small culinary amounts. A little garlic in a soup, stew, or stir-fry is fine. Avoid raw cloves or garlic supplements unless approved by a doctor. Avoid concentrated garlic extracts. These may carry the highest risk of overstimulating the brain. Balance with brain-healthy foods. Blueberries, walnuts, salmon, leafy greens, and turmeric are all shown to support memory without the overstimulation risk. Work with a healthcare provider. Every Alzheimer's patient is different. What's safe for one may be risky for another. For families caring for loved ones with dementia, the message is clear. Garlic is not a miracle cure, and too much can backfire. Seniors with Alzheimer's already face daily challenges, so the goal should be gentle support, not aggressive remedies that may destabilize brain function. The takeaway? In Alzheimer's disease, moderation is everything. A touch of garlic in meals may be helpful, but overuse can worsen confusion and agitation. By treating garlic as part of a balanced diet, not a medicine on its own, you can protect the brain instead of overwhelming it. Mistake number 8, eating a lot of garlic without balancing calcium. Silent risk for senior bones. Most people know garlic for its heart benefits, lowering blood pressure, fighting cholesterol, and boosting immunity. But what many seniors don't realize is that garlic also affects how the body handles calcium. And here lies a hidden danger. Eating a lot of garlic every day without enough calcium intake can quietly weaken bones over time. How does this happen? Garlic contains sulfur compounds that can slightly increase calcium excretion through urine. Normally, this isn't a problem for younger adults with strong bones and high calcium reserves. But for seniors, whose bones are already thinning due to osteopenia or osteoporosis, this extra calcium loss can tip the balance toward bone weakness, fractures, and even loss of independence. I remember Mrs. Carter, a 71-year-old who loved raw garlic. She proudly told me she ate 2 cloves every morning to keep her arteries clean. But over the years, she began experiencing hip pain and was diagnosed with reduced bone density. When we reviewed her diet, it turned out she wasn't eating much dairy, leafy greens, or other calcium-rich foods. The daily garlic wasn't the only factor, but it accelerated the depletion of calcium from her bones. She thought she was protecting her heart, but at the same time, she was neglecting her skeleton. Scientific evidence supports this concern. Studies from the Journal of Bone and Mineral Research confirm that calcium balance is especially fragile in adults over 60. Even small increases in calcium loss can worsen osteoporosis. Since garlic slightly raises calcium excretion, seniors who don't get enough calcium in their diets may face a double risk: weaker bones and higher fracture potential. The danger is real. In the United States, 1 out of every 3 women and 1 out of every 5 men over 65 will experience a bone fracture due to osteoporosis. Hip fractures, in particular, are devastating, often leading to long hospital stays and even increased mortality. Seniors cannot afford to lose calcium silently. So how do we fix this mistake? The answer isn't to avoid garlic, but to balance it with calcium-rich foods. Here are some practical strategies. Pair garlic with calcium foods. If you enjoy garlic in cooking, add it to meals with yogurt, cheese, or fortified plant milk. Garlic sautéed with kale or broccoli gives both heart and bone benefits. Ensure daily calcium intake. Seniors should aim for 1,000 to 1,200 milligrams of calcium per day from food and, if needed, supplements approved by their doctor. Don't forget vitamin D. Calcium is useless without vitamin D to help absorb it. Sunlight, fortified dairy, or supplements can help. Use garlic in moderation. 1 clove a day in meals is usually safe. Avoid overloading on raw garlic unless balanced with the right nutrition. The takeaway is clear. Garlic can protect your heart, but only if you also protect your bones. Seniors should never forget that bone health and cardiovascular health go hand in hand. Eating garlic without enough calcium is like saving one system while quietly draining another. By pairing garlic with calcium-rich foods and ensuring a balanced diet, seniors can enjoy garlic's benefits for the heart without sacrificing the strength of their bones. Mistake number 9. Eating raw garlic in salads. Too harsh for the aging stomach, salads are often seen as the ultimate health food. Fresh greens, colorful vegetables, maybe a drizzle of olive oil. It feels light, natural, and nourishing. Many seniors in the U.S. like to add raw garlic into their salad dressings, believing it will make the meal even healthier. After all, raw garlic is packed with allicin, antioxidants, and antibacterial compounds. But here's the hidden problem. Raw garlic, especially when eaten on an empty stomach or in large amounts, can be far too strong for seniors' digestive systems. Raw garlic releases allicin in its most concentrated form. While this compound is powerful against bacteria and inflammation, it's also caustic, meaning it can burn or irritate delicate tissues. For younger people with strong stomachs, this may only cause mild discomfort. But for seniors whose stomach linings are thinner and often weakened by age, medications, or conditions like gastritis and acid reflux, raw garlic can cause severe irritation, heartburn, bloating, or even micro-ulcers. I remember Mr. Daniels, a 73-year-old who prided himself on eating raw, natural foods. He told me he chopped 2 cloves of garlic and tossed them straight into his daily salad. Within weeks, he began experiencing burning sensations after meals and occasional nausea. His doctor later found signs of gastritis, stomach lining inflammation, made worse by his daily raw garlic habit. Science backs this up. Research from the National Institute of Diabetes and Digestive and Kidney Diseases shows that raw garlic can relax the lower esophageal sphincter, the valve that keeps stomach acid from rising. This means raw garlic can trigger or worsen acid reflux, a condition already common in adults over 60. On top of that, raw garlic may interfere with medications by altering how they are absorbed in the digestive tract. So what's the solution? Seniors don't need to give up garlic in salads completely. They just need to use it wisely. Use roasted or lightly sautéed garlic instead of raw. Cooking garlic gently makes it sweeter, softer, and far less irritating, while still offering many of its benefits. Make garlic-infused oil or dressing. Let a clove of garlic sit in olive oil for a few hours, then remove it. The oil will carry a mild garlic flavor without the harsh bite. Keep the dose small. If you love raw garlic, limit it to half a clove, finely minced, and always mix it with other ingredients like yogurt, avocado, or tahini to buffer its strength. Listen to your body. If you notice burning, bloating, or discomfort, switch to cooked garlic instead. For seniors, food should be healing, not harsh. The truth is, while raw garlic may sound like a health booster, it can quietly erode stomach comfort and even reduce nutrient absorption. The takeaway? Raw garlic in salads may look healthy, but for aging stomachs, it's often too aggressive. Seniors can enjoy the flavor and benefits of garlic more safely by using it roasted, blended into dressings, or added at the end of cooking. Gentle on the stomach, yet still powerful for the heart and immune system. Mistake number 10. using garlic as a liver detox. Overuse can backfire and harm the liver. In recent years, detox has become a buzzword. From juices to supplements, many people believe certain foods can flush toxins from the body. Garlic often tops the list of so-called detox foods. Seniors in particular may hear advice from friends or on the internet. Eat raw garlic every morning. It will cleanse your liver. But here's the truth. Your liver doesn't need garlic to detox. It already does that naturally, 24 hours a day. And when garlic is consumed in excessive amounts, instead of helping, it can actually strain the liver and cause damage. Why? The liver is responsible for processing not only toxins, but also nutrients, medications, and natural compounds from food. Garlic's sulfur compounds, especially allicin, are powerful. In small amounts, they support detox enzymes and fight inflammation. But in large doses, these same compounds can become hepatotoxic, meaning toxic to the liver. Overloading the liver with raw garlic or concentrated supplements forces it to work harder, leading to elevated liver enzymes, fatigue, or even inflammation. I recall Mr. Bradley, a 70-year-old retiree who came to me feeling constantly tired and nauseated. He believed he was cleansing his liver by eating 3 raw cloves of garlic every morning on an empty stomach. But his blood tests told another story. His liver enzymes were elevated, a sign of liver stress. When he cut back on the raw garlic, his liver function returned to normal within weeks. What he thought was protecting his health was quietly wearing his liver down. Scientific studies have documented this risk as well. While moderate garlic intake is safe, animal research has shown that very high garlic doses can cause liver toxicity, including fatty changes and cell damage. In humans, excessive garlic supplements have been linked to digestive distress, liver enzyme elevation, and even interference with prescription drugs. This issue is especially serious for seniors, many of whom are already on multiple medications. Garlic can alter the way the liver metabolizes drugs for blood pressure, cholesterol, or diabetes, either reducing their effectiveness or increasing their side effects. Instead of detoxing, this creates new problems. So what's the safe way forward? Understand the liver's job. The liver already detoxes naturally. What it needs is support through a balanced diet, not extreme remedies. Use garlic as a food, not as a medicine in large doses. 1 clove a day in cooking is usually safe and beneficial. Avoid raw garlic shots or large amounts on an empty stomach. Avoid garlic supplements unless prescribed. These are concentrated and carry higher risks for liver stress. Support your liver in other ways. Stay hydrated, eat plenty of vegetables like beets, spinach, and broccoli. Reduce alcohol and maintain a healthy weight. Check liver health regularly. If you're eating garlic daily and feel fatigue, nausea, or abdominal discomfort, ask your doctor to test your liver function. The takeaway? Garlic is not a magic detox tool. Used wisely, it can support health, but used excessively, especially in the name of cleansing the liver, it can do the very opposite, quietly harming the organ you're trying to protect. For seniors, the safest path is moderation. Enjoy garlic as part of meals, not as a cure-all. By respecting both its power and its limits, you will keep your liver strong and your health protected. So today, we've uncovered the hidden side of garlic together. We learned that this humble bulb, so often called nature's medicine, can truly protect your heart, boost your immune system, and even help your memory. But only if you use it wisely. Overcooking garlic, chopping it too quickly, cooking it at high heat, eating it right after brushing your teeth, or leaving it out too long, these small mistakes can quietly erase its healing power. And in certain situations, like during chemotherapy, with Alzheimer's disease, without enough calcium, raw in salads, or in liver detox fads, garlic can actually harm rather than heal. The truth is simple. Garlic can either be your most powerful ally or a silent enemy. For seniors, whose bodies are more sensitive and who need every bit of support for the heart, brain, bones, and digestion, using garlic the right way makes all the difference. So my advice to you is this: Treat garlic with respect. Use it in moderation. And always balance it with a healthy, varied diet. I'm Dr. Emily Carter, and for more than 20 years, I've helped older adults use food as medicine to stay strong, independent, and full of life. If today's video helped you understand garlic in a new way, I encourage you to subscribe to our Senior Healthcare channel so you won't miss the next simple but life-changing health tip. And before you go, I'd love to hear from you. How do you usually eat garlic? Raw, cooked, or in supplements? Share your experience in the comments below. Your story might inspire someone else in this community. Thank you for spending this time with me today. Stay well, stay strong, and I'll see you in the next video.